Hi, my name is Kelsey, and I'm a Temple medical student. Today on Health ABCs, we'll be talking about diabetes. In this talk, we'll be answering what is type 1 diabetes, what is type 2 diabetes, what are the treatments for each type of diabetes, what are the common symptoms, what are the ways to prevent type 2 diabetes, and lastly, where can I find more information about diabetes. Firstly, this talk was solely created by medical students for the purpose of patient education. It is not to be used as medical advice and does not replace seeing your doctor. To begin, what is type 1 diabetes? So, in type 1 diabetes, your pancreas is unable to produce insulin. This is an autoimmune condition, meaning your body's immune system recognizes the cells in your pancreas as foreign and will attack them. This leads to those cells being damaged and not able to produce insulin. You need insulin because it is a hormone that allows glucose, which is sugar, into your cells to use as energy for everyday bodily functions. With no insulin, glucose builds up in your blood, which can damage different organs. And what is the treatment for type 1 diabetes? The treatment is replacing the insulin your body cannot produce. This is either done through injections of insulin or through an insulin pump. Now, what is type 2 diabetes? Type 2 diabetes is a little more complicated than type 1. Normally, when you eat food, glucose will enter your body, and this increase in glucose will result in the release of insulin so that the cells can take up glucose. Type 2 begins with the inability of the cells to use insulin appropriately and take up the glucose. In other words, your body cannot tolerate the glucose that has been eaten. We can measure this amount of glucose remaining in your blood through laboratory tests, and this is an important way we diagnose diabetes. With time, the pancreas has to produce more and more insulin to help the cells take up that same amount of glucose. Similar to a machine, say an engine that is constantly on, it can lead to your car dying. When the pancreas is constantly producing insulin, it can begin to fail. This is called pancreas burnout and will lead to increasing blood sugars. And this also explains why we want to start treatment early to 1, give your pancreas a rest, and 2, reduce those blood sugar levels. So, what is the treatment for type 2 diabetes? Early treatment for type 2 diabetes is mainly focused on increasing your cell's ability to respond to insulin to then take up the glucose for energy. We call this increasing your insulin sensitivity. This is achieved mainly through lifestyle changes such as nutrition and exercise. These changes can dramatically increase your cell's ability to use insulin and decrease your blood sugar levels. One of the first medical therapies we use is called metformin. The goal of this medication is similar to lifestyle changes. It will help your cells use the insulin your body makes. The next steps in medications can vary from person to person. There are many different additional medications that help lower blood sugar levels, and which one is used depends on the conversation between you and your doctor. The last step in treatment is to use insulin injections. This will increase the amount of insulin in your body and is used when other medications cannot sufficiently lower the blood sugar levels. Now, what are the common symptoms? Symptoms of diabetes can start pretty vague, and some are shown on the screen. The most common symptoms will be an increase in urination and an increase in thirst. I know when I was undiagnosed and subsequently diagnosed with type 1 diabetes, I experienced an unquenchable thirst, and I didn't realize that this was a symptom of diabetes. These two symptoms are key symptoms that can clue you and your doctor into what may be going on. Another very common symptom is extreme fatigue because your body is not able to use glucose for energy. Other symptoms may be an increase in appetite, weight loss, and irritability. More so in type 2 diabetes, patients may experience blurry vision, as well as tingling and numbness in the hands and feet. Some differences in type 1 and type 2 can be the onset. Type 1 usually occurs at a younger age, while type 2 is usually in adulthood. However, more children are coming in with type 2. And what are ways to prevent type 2 diabetes? Of note, because type 1 diabetes is an autoimmune condition, there are no preventable measures that will decrease your chances of the disease. There are several ways to decrease your risk of type 2 diabetes. Some are displayed on the screen. Number 1, eating a healthy and balanced diet. It should contain fruits and veggies, lower in sugary or high carb food, as well as cutting down on sugary drinks and replacing them with water or a diet drink. Number 2, exercising or moving consistently. Something like a 20-minute walk several days in a week can help immensely. Or during these COVID times, making sure you stand and walk around throughout the day. Number 3, cutting out or cutting down on smoking. And 4, regularly visiting the doctor's office. A lot of these modifications will help in weight loss, which will significantly decrease the risk of diabetes. The excess fat is the main way your cells become unable to use the insulin properly that your body produces. Also, a lot of these changes are hard, so small achievable goals should be set. Regular visits with your doctor can help guide you and keep you on track to being successful. Lastly, where can I find more information? The top 3 links are more general information about diabetes, as well as other resources for prevention and nutrition, and lastly, for resources in Spanish. Thank you.